Doctor, I know you're asking folks who are protesters to get tested. Are you actually tracking that? And what are you seeing so far?
We are encouraging everyone to get tested. We are not specifically determining if someone, or asking if someone is a protester, but we are acknowledging that if someone has participated in a large gathering, that is a way to go ahead and be tested if they've gone to a protest where there is such a large gathering of people. As the governor mentioned, we've been seeing lower numbers, particularly over the weekend, than we would like. Towards the end of last week, we were well over 1,000 people who have been tested overall through the self-scheduling portal. So it's portal.ri.gov that we continue to encourage people to go to be tested if they fall into one of the work categories that the governor has shared, or if they have attended one of the protests.
Doctor, I know it's been 10 days since the large protest in Providence, and so that's on the early end of seeing cases, but do you have any indication so far that through your contact tracing that anybody who was at a major rally was sick?
It is still early, but we are not seeing any large numbers as of yet. I'm encouraged because the mask wearing, particularly with the thousands of masks that the Rhode Island Department of Health handed out, the mask wearing during the protests that had occurred the week prior was very good. And so we're hopeful that that did its part. As we know, masks are very effective in stopping transmission. So we're going to continue to see if the numbers stay the way they are, and it will help affirm the necessity of wearing masks and staying home if you're sick.
Doctor, I noticed that not only the Providence protests, but in Newport, a number of people wearing black T-shirts with the Rhode Island Department of Health's emblem on them. Are they the folks that were out there handing out masks and so forth? And were they reporting back to you or the administration at large with any specific information that they may have seen out there?
Yes, if they had the black T-shirt with the Rhode Island Department of Health, they were either our awesome staff or partners to the department who wanted to be present to help ensure that people are safe, giving out masks, giving out information on COVID-19. We very much appreciated those that offered to do that. I didn't collect any additional information beyond that. We have supported those who have done that to go ahead and get tested. So that was done during this last week, and anyone else who attended the protest is what we recommend as well. I've done that as well.
Governor, on summer school, are you, or the summer programming, are you giving any guidance yet about whether districts should be allowing students to keep their laptops or Chromebooks? I think about that as like a problem in Providence and some of the urban districts.
Dan, can you just talk louder or go ahead?
Are you encouraging districts to let students keep their Chromebooks or whatever is provided by districts?
Yeah, it's a great question. That's their call. I know, Matt, that is the call of the district, but I would say yes. I mean, because we want kids to continue to do schoolwork over the summer, which is why we're putting out this whole new SAIL initiative. And we know that there are many kids who don't have their own laptop. So I'm not going to tell the districts what to do, but I think it's a good thing to do.
Dr. Alexander-Scott, I was just looking at the new data and the demographics, and one of my colleagues actually spotted that there is now an entry in the age group of 10 to 19, a fatality. Is that just a reporting error, or did that actually occur?
No, unfortunately, there was one COVID-19 death that we confirmed late last week as a pediatric death. This person had a very significant underlying health condition, tragically. And there isn't any more information that we're able to release, but that was something that we were saddened by, but also we're aware of.
Can you just sort of talk anecdotally? I mean, this is the first pediatric death that we've seen. Should parents be concerned? Was there any connection to the inflammatory illness that we've seen pop up in other states? I know you said this person had a severe underlying health condition. So what does it mean, essentially?
Yeah, it is more so connected to the unfortunate underlying health condition, less so connected to any other concerns that have been seen in other places regarding pediatric cases. So they unfortunately fell into the category that's similar to those who are either older or have underlying health conditions, and this one had some more severe ones, which unfortunately put them at a significantly increased risk, and that was certainly an exception compared to what we're seeing, given that the numbers among pediatric cases is extremely low.
Did this child have any connection to group living? Were they in DCYFK or anything like that?
I don't have that additional information on them.
Governor, as you probably know, the New York Times reported over the weekend that you have had conversations with Joe Biden's team about potentially being vetted for vice president. Can you talk about that, or have you actually had these conversations?
Yeah. One of your colleagues asked me about this a couple of weeks ago, and nothing's changed since I answered it then, which is to say, I am 150% focused on doing my job in Rhode Island and spending no time on politics. I have the job I want, which is being governor of Rhode Island.
But to be clear, the Times reported that you have had conversations with the teams. Were they wrong?
I have nothing more to add than what I said.
Governor, can you sort of, looking back on the last few months, there was a point where it seemed like, you had reported you were barely sleeping, that it was around the clock, a 24-hour operation, the whole team at large. What is that operation like today? Are you able to spend time on things outside of COVID a significant amount of time? What has changed in your world in recent times?
So look, it's a challenging time to govern. We have historically high unemployment. None of us has ever really lived this kind of unemployment. The record, over 200,000 unemployment insurance claims. A public health crisis, global public health pandemic. And civil unrest. The race riots, it was just last Monday night, I think, that we had, or maybe 2 Mondays, it was recently, that we had looting and cars on fire in the capital city. So I'm not going to lie, we have our hands full trying to lead Rhode Island securely through these 3 major crises all at once. On the one hand, we have a much firmer handle on the COVID response. I mean, now I have a full-time team on testing. They are rocking and rolling, doing their thing. Pretty soon, we're going to have 20% of our population tested. That's fantastic. We have a team on contact tracing. The app is up. Please sign up for COVID, Crush COVID RI if you haven't. So we're not out of the woods, as I've said so many times. And each day, I begin my day by looking at the data and kind of hold my breath, hoping that we don't see any increases. And I look at other states, and I get nervous. So we are on it, every minute. Speed matters. But we're in a much, much better place. Our hospitals have plenty of space in them. By and large, people are doing what they're supposed to do. We only have a few dozen cases, so that's good. I'm spending more time now thinking about how do we get people back to work. The stories are heartbreaking. I don't know if my restaurant can reopen. I don't know if my business will reopen. We've invited people to come back to work, and people are too afraid to come back to work. So I think it's still a pretty 24/7 operation. I'm encouraging the team, myself included, to take a few hours here or there to refresh. COVID we feel good about it, but there's these 2 other big issues. I mean, just yesterday, 2,000 people protesting in the State House. This is real, and so we just have to lead through it. But I will just say, it's an anxious time for all people in Rhode Island. That's true for people all over the country. And we are doing about as well as anyone, and I am one foot in front of the other. One foot in front of the other. We're in a good position, and I am totally committed to make sure our economy is stronger on the other end of this than when we went into it. So I'm spending more time thinking about that. What are the investments we need to make so that we're stronger and when we come out than when we went in?
Governor, you're the governor, not the mayor. But if we go down this hill, the Biltmore is boarded up, the hotel at Fleming's is boarded up, all over Providence, you see stores boarded up. Is Providence open for tourism?
Yeah. So I can't tell business people what to do when they put those boards up because they were afraid. But it is safe, and it is open for business, the city. You know, I'd encourage them, if I should say, like, it's okay to take the boards down. It's okay to hold yourself out for business. We had a scary week, and I'm not going to discount that. But we handled it, right? We kept the lid on the violence. We had no major injuries. I'm not minimizing it, but we were on it. And so it's time to feel secure, and it's time to be open for business. And it's true, I'm not the mayor, and I don't own a business, and I know they're nervous. But like we went out for dinner last Thursday night in the city of Providence. I'd like to keep going out for dinner in the city of Providence. Go to the mall, go shopping, go to Fleming's. Like, I think it's time to feel secure. We can't live in fear. We have an amazing state police, National Guard, and City of Providence Police Department. Let's get out there.
You mentioned tonight the special for the seniors, and there's music. Mm-hmm. Now, what song are you performing this evening?
Nice try, John.
Doctor, back on the contact tracing, are you able, as kind of the case numbers go down, are you able to see again, where some of these cases are coming from? Do you have any indication that some people are getting sick in crowds, whether it's at a store or something like that? Or is it mostly they can pinpoint who they got it from or who they may have been in contact with?
Yeah, that's a great question. Once we have community transmission, it is challenging outside of specific congregate settings to be able to determine where someone was exposed. We do have extensive conversations collecting that information to understand what their work setting may have been, understand what events they may have attended, or who or where they've been, who they've been with, or where they've been. It does reinforce the importance of the core recommendations, because we are seeing when you are wearing your mask, when you are distancing effectively, when you are staying home, when you're sick, it significantly decreases the chances of you being exposed in the community without knowing. So the more we can continue to encourage people, as the governor was just saying, being able to get out into the community, going to the mall or to the restaurant or to the store, knowing that wearing your face covering, using hand sanitizer, not going out if you're sick, those are the core ways that's the key message that we're getting through the data. Those are the core ways to significantly decrease your risk of being exposed.
Doctor, does the data that you have give you any ability to quantify relative risks from different activities? In other words, how much riskier is it to dine out at a restaurant than to take a RIPTA bus or to attend a protest? Do we have any idea of that?
We are assessing that at more of a national level. Our numbers are so small, it's challenging to specifically calculate what a relative risk would be and what the correlation is. But nationally, compiling that information, we're continuing to see the same rules of thumb. The longer you are in a closed setting, closely positioned, without a mask, the higher the risk of getting exposed to COVID-19. The more you are wearing a mask, distancing, around other people for shorter periods of time, and out in the fresh air, much lower risk. So this weekend, my husband, our infant son, we spent tons of time at the park, outside, with our masks, just enjoying, and there were a number of people there, but fully felt safe because we were taking advantage of those types of risk profiles. And our focus is to help people understand those differences so that you can continue to get the courage and comfort level with going out, keeping those types of rules in place. That's what works to stop transmission of COVID-19.
Governor, you were talking about the importance of getting people back to work. And as you may know, or I'm sure you know, that the PP program for most businesses expire at the end of June, at which point many of the people they took off, that they had laid off, will then be faced with either being laid off again if there's no work. And I'm wondering if you're anticipating a spike in unemployment as a result of that, what you would suggest in terms of either extending that program or also looking at the program that provides $600 a week to employees that in some cases has been viewed as a deterrent for those people to return to work.
Yeah. So there's a lot to unpack there. I'll say a couple things. I would support continuation of PPP, the loan program. I also am really counting on the federal government to step up with another stimulus. And I'm also open to using some of our emergency COVID relief fund to help Rhode Island small businesses. I'm just holding off a little bit longer on that until I have some clarity as to whether we're going to get another stimulus, because right now we're facing this unprecedented budget deficit. So there's a period of uncertainty for the next few weeks. The honest truth is we need Congress to take some action, and the sooner they do it, the better we'll be. I know there's consideration of extending the $600. I know there's consideration of extending the PPP initiative. There's a lot of talk in Congress around additional small business support. Any version of that is desperately needed in Rhode Island, and I am urging our federal delegation to work as hard as possible for it, which of course they are. It's in the hands of Mitch McConnell and the Trump administration. But I'll tell you this, the impact to Rhode Island will be utterly devastating if we don't get another round of stimulus. I can't see a way around it. So to answer the other question, how I spend my time, I spend a lot of time talking to members of Congress, other governors, Republican governors. We're all in the same boat. And so we are all pushing Congress to say, do the right thing. Because if you don't help states more and don't help small businesses more, in whatever form they take, this recession is going to be a lot longer and more painful than it needs to be. So it's, as I am told, it's all going to happen in the next 4 weeks or so.